क्या मेरी तरह आपने भी कभी सोचा है व्हाट इज स्पेशल अबाउट आवर ह्यूमन माइंड? इट नेवर स्टॉप्स आस्किंग क्वेश्चन व्हाट, हाउ, व्हाट इफ। चाहे हम किसी भी फील्ड से हों, डॉक्टर हो, इंजीनियर हो, एंटरप्रेन्योर हो, सीए हो, आर्किटेक्ट हो, वगैरह वगैरह, बट सब में एक चीज कॉमन है, वो है हमारा ह्यूमन माइंड। हमारे ह्यूमन माइंड की एंडलेस क्यूरियोसिटी और हंगर टू लर्न, टू एक्सप्लोर न्यू एंड न्यू एरियाज ऑफ इंटरेस्ट, चाहे वो उनके फील्ड का हो, चाहे वो किसी और फील्ड का हो, ये सब में रहता है। और इसी वजह से हम इतने क्वेश्चंस पूछते हैं गूगल से, चैट जीपीटी से, एआई से, कि मुझे लगता है कभी कभी कि ये भी थक जाते हैं, बट आवर ह्यूमन माइंड नेवर शट डाउन। सो देन आई थॉट व्हाई नॉट टू गिव आवर ह्यूमन माइंड अ माइक, एंड हियर माय पॉडकास्ट इज बॉर्न, बियॉन्ड स्माइल विद डॉक्टर श्वेता। Hi everyone, I'm Dr. Shweta, a dentist and periodontist by profession. I have been honored and blessed to provide numerous beautiful smiles to numerous beautiful people. मेरे 30 साल के क्लिनिकल एक्सपीरियंस से मुझे एक चीज बहुत फैसिनेट की है कि हर स्माइल के बियॉन्ड, सबकी मुस्कुराहट के पीछे एक न एक स्टोरी, एक स्ट्रगल, एक जर्नी होती है, चाहे वो उनके सक्सेस की हो, चाहे वो उनके फेलियर की हो, बट सब में कुछ ना कुछ राज छुपा होता है, एंड विद दैट वी कैन लर्न। सो इसी मोटिव के साथ मैंने ये पॉडकास्ट शुरू किया है, बियॉन्ड स्माइल विद डॉक्टर श्वेता। So we are learning about organ transplant thing. So face transplant also can
face transplant is being done for the patient who have, of course, who have grotesque injury because of the acid attack.
Why men में एक certain area होता है there only baldness happen? Like why it is like that?
Like there is an enzyme.
Okay.
5-alpha reductase type 2, okay, which is present in the roots of the hair.
There is no any criteria कि आप इतने बार करा सकते हैं. Like today you have gone for the surgery, again the person is coming back for the another surgery.
The thing is, we are depending on the tissue.
Okay.
For healing. Okay, we are depending on the skin over the cartilages, bones which are there underneath, how it is there.
The surgeries, their face become little expressionless, या कह सकते हैं कि थोड़े प्रोटोटाइप टाइप लगते हैं। जो करा रहे हैं कॉस्मेटिक सर्जरीज, उनकी फेस थोड़े सिमिलर लगने लगते हैं।
It's not like that. The plastic surgery means we are enhancing the beauty. We are not changing your character of the face, or we are not changing your facial all the features. We're just enhancing it.
हेलो एवरीवन, सो आज के हमारे पॉडकास्ट के चीफ गेस्ट हैं डॉक्टर स्वरूप सिंह गंभीर, जो कि को चेयरमैन एंड हेड हैं प्लास्टिक कॉस्मेटिक सर्जरी सेंटर सरगंगाराम हॉस्पिटल के, एज वेल एज ही इज़ अ डायरेक्टर ऑफ पर्सोना सर्जरी सेंटर इन पटेल नगर। सो आइए आज हम जानते हैं उनके साथ प्लास्टिक सर्जरी एक्चुअली क्या क्या चीज़ें करवा सकती है, कुछ लोगों की ज़रूरतें और कुछ लोगों की चाहतें, इन दोनों का कॉम्बिनेशन है प्लास्टिक सर्जरी। Let's start today's episode. Welcome sir to my podcast Beyond Smile with Dr. Shweta. सबसे मज़े की बात ये है कि मैंने इनके साथ 2 साल काम भी किया है, and I'm very much blessed to have learned a lot of things from him. So चलिए बात करते हैं प्लास्टिक सर्जरी की। सर, एक जनरल कंसेप्शन होता है लोगों का कि प्लास्टिक सर्जरी मतलब एस्थेटिक्स और ग्लैमर, सेलिब्रिटी लोग आते हैं, प्लास्टिक सर्जरी कराते हैं, इन्हांसमेंट कराते हैं, बट वी नो कि ये बहुत वास्ट एरिया है, ट्रॉमा केसेस जुड़े हुए हैं, हाथ कट जाते हैं लोगों के। तो मैं ये जानना चाहती हूँ एक ब्रीफ इंट्रोडक्शन कि एक्चुअली प्लास्टिक सर्जरी क्या क्या चीज़ें कर सकती हैं।
Thank you, Dr. Shweta.
जी.
Okay, for inviting me here. The plastic surgery is a very broad term. Okay, literally in plastic means it comes from the Latin word known as plasticos, which means to mold. As a plastic surgeons, we are molding the tissues. We are recreating tissues from different places which are in which area they are required, or we are modifying it for beauty purposes if needed. In plastic surgeries, we are trying to mold the tissues. Okay. In plastic surgery, there are various things that we are doing. Okay. The normally people those are various plastic surgeons basically do a beauty work. It is one part of the surgery. Okay. Cosmetic surgery is one part of plastic surgery. Other things that we are doing is restoration surgeries in the form of oncoplastic. Like if you have got a cancer, and the cancer surgeon, oncosurgeon take out the tissues, and we need to reconstruct them. Okay, so it's a part of reconstruction part. If certain patients who have injuries in the form of they have cut their limbs, like wrist is cut, or the fingers are cut, or the arm is cut, that needs to be reattached. that part is being done by plastic surgeon. And other surgeries, like suppose you have got a road traffic accident and you have got a lower limb injury, the bony part is being taken by the orthopedics, and the tissue part, the skin part, is being taken care by us. Whatever is being required, we'll do it. If it requires local tissue transfer, we'll do it. If it requires free tissue transfer, we do that part. Nowadays, another part that we are dealing is a transgender surgery.
Oh.
Okay. The sex change procedure, as most of you have heard of.
Yes.
Okay. Either we are doing from male to female, or we are doing from female to male, whatever gender surgery is required. So that is part also being done by a plastic surgeon.
So ये जो सर आपने बात कही है that transgender surgeries, so in this hormonal things that we have to imbibe.
I understand your point. It's a team effort. Every surgery is a team effort. It's not a single man job. We are just doing one part of the thing.
Okay.
Like the patient who have a gender dysphoria, they first require a psychiatrist workup, and they have to be cleared by a psychiatrist that this patient has got a gender dysphoria. He definitely requires certain procedures to be done to make his true identity, and then the endocrinologist come into play. He start giving the medication so that they get used to it, and the different medication that they've been taking, different hormones they are taking. Suppose he's a female, they will add certain male hormone to that. So the female patient will have change in voices, the growing beard. So let them first used to it. So it's a gradual process, not a one-day process. It's a team process and a gradual process. It's not like you decided one day I want to get a gender change. It's not done. It takes more than a year time for a person to come to the surgical part.
Yeah, understood. Then sir, I want to know about the reconstruction part. Till कहाँ तक किस हद तक we can reconstruct, like acid attack survivors की बात करें, their face get demorphed fully. So किस level तक we can do that reconstruction part?
It's very difficult question to answer which level we can do. We try to bring them as normal as before, but there are limitations. Limitation in the form of depending on the depth of injuries they have got with acid burns. Certain patients they get very superficial burns with acid, so it's nearly normal that we can create. Certain they get all the tissue burnt from skin to the bone till the bone area. So it's very difficult to reconstruct the movement part of the face. And then we need to just add tissues which is presentable to the social society, and the form that we work on that part.
So we are learning about organ transplant things. So face transplant also can
Face transplant is being done for the patient who have grotesque injury because of the acid attacks, or due to fire injuries, or to the RTAs, road traffic accident. If the certain grotesque injuries are there, which is patient is not socially presentable, he is stuck in his room, not going out because of the grotesque deformity, and he don't want to wear the prosthesis also. Okay, that is very important part. Prosthesis comes the first rather than a face transplant. Okay, if we can make him presentable with prosthesis, that should be the first choice. The face transplant looks very good to hear.
Yes.
Like we can change the face of the patient.
Yes.
A lot of movies has come into play because of the face change.
Yes.
Okay, but still it is not a very simple thing. What we are doing, we are taking a tissue from a person who is brain dead, transplanting to a person who is healthy otherwise, but has got a deformity of the face. The face will be totally transplanted, can be partial, can be complete. And after that, once you have transplanted the tissue, the thing comes, body try to reject it.
Yes.
Okay, you must have heard patient who had gone under liver transplant or kidney transplant, they require lifelong medication.
Correct.
So that body doesn't reject.
Correct.
So the issue comes into play that it requires lot of drugs to decrease the rejection. We cannot stop it, we try to decrease it. The issue that is coming nowadays is, what if rejection is there, then what? Okay, till date around 26 face transplant has been done, both partial and complete together, and patient has survived. But always there is a problem coming, is what will happen once it is rejected. 2 patients have died already during the course of the treatment. So that's the main problem is coming. Lot of ethical problems are there.
Okay. Then I have a question in mind about this implant, sir. Like you told that all type of cosmetic surgeries, This how much pain and recovery time people have to go through it?
Which type of implant you're
Like
talking about?
any to increase the body size or certain body
Breast
parts,
implant or soft
breast
implant?
implants or
Okay.
something.
Okay, fine. The thing is, it's not the pain part that we are bothered about, because this breast implant, if you talk of just one implant now, we just talk of breast implant. The breast implant is not a new procedure. It's a procedure which is done since 1970s.
Yes.
It's not a new procedure. It's from since 1970 till 2025. Lot of research has been done. Lot of upgradation has been done on the implant. We have simple silicone fluid to implant the capsule now, to the cohesive gel, to the textured implant. Lot of implant improvement has taken place for two purposes: the rejection rate to decrease and complication to avoid. Okay, it is nowadays the implant that we are putting is very, very safe, and chances of rejections are very, very minimal. I won't say we have not seen any rejection. Of course, it's a foreign body, risk of infection always there initially, but once it settles down, there's no chance. Okay, in long term, if we talk about 10 to 15 years of time, certain patients do develop foreign body. Whenever there's implant is there, it forms a capsule around that body, try to protect it. Okay, in late phase, around 8 to 10 years or 15 years of time, these capsules, they try to contract. So capsule contracture is the painful part.
Okay.
Patient start feeling there's a tightness is there's a wrinkling is there's a pain is there on the breast area. So that time we have to replace the implant. That means you have to remove the capsule and replace the implant if the patient desire.
Okay. Are all kind of cosmetic surgeries reversible? Like लोगों को पसंद नहीं आया मेरा किसी ने नाक की surgery कराई.
No, it's not. It's not like that.
It's not
Only
like
the
that.
implant surgery are reversible.
Only implants are reversible.
Implants is reversible. No other surgery is reversible.
Okay, I have seen some celebrities going through lot of surgeries. Like एक बार उन्होंने कराया face का surgery, फिर उनको पसंद नहीं आया, again they have gone through.
This is not reversal. It is called revision.
Revision.
The word changes.
Okay.
Certain, suppose if you are doing a rhinoplasty to the patient, and patient, of course, because we are depending on the end point, once you do the surgery, body to heal, and body sometimes heals not a way that you desire.
जी.
Certain patient, they get a bump or slightly deviation, so they want to be corrected. Okay, so they do the revision surgery.
Revision surgery. Okay.
So it's the end point. If it is not desired to reaches to the point that you desire, you can do a revision surgery.
Okay. So there is no any criteria कि आप इतने बार करा सकते हैं. Like today you have gone for the surgery, again the person is coming back for the another surgery कि no, I want some revision surgery again. Still he is not satisfied, he or she is not satisfied. तो कोई एक particular criteria नहीं, इससे ज़्यादा आप नहीं करा सकते.
The thing is, we are depending on the tissue for healing. Okay, we are depending on the skin over the cartilages, bones which are there underneath, how it is there.
Okay.
The more you try to do the surgeries, every time you go inside, you are damaging a tissue. Okay, and you're decreasing the thickness and you decreasing the scarring, and chances of blood circulation decreases every time.
Okay.
So if you're doing surgery 1 or 2 times is okay. If you're doing surgery 4 to 5 times, then the risk of skin necrosis tremendously increases. It is to the surgeon who decided that he wants to take the risk or not. And I've stopped I've rejected many patients. I'm not doing it because they have come for 6 to 7 surgeries. I said I'm not going to do it. It's not worth it. Okay, so take the risk of skin necrosis. Okay.
So we have to see the risks also accordingly.
Because they don't understand. Because as a doctor, as a physician, I have to guide them that this is not. Sometimes you have to accept what you have achieved.
Yes. So coming to the non-surgical part, ये तो surgeries we have spoken about. Non-surgical part like Botox, fillers, जो हम बहुत सुनते आ रहे हैं. So what exactly is the difference between Botox and fillers? Females must want to know about this.
Botox is basically what we are doing is we are paralyzing the muscle. Okay, it comes from bacteria known Clostridium botulism. So what it does, it paralyzes the muscle. With the doses and everything now standardized worldwide, we know which area to paralyze to give the desired result. If you are coming at an age where just wrinkling has just start forming in the forehead basically, so we just paralyze those muscles which have started forming the contraction part. So that wrinkling is delayed. We cannot stop it. We can delay the process.
Delay the aging process.
Delay the aging process. Nobody can stop it.
Yes.
Okay. So suppose there is crow's feet are there. Certain patient who has got a mentalis dimple in the chin part, dimpling is there. Those who want to slightly lift the
Facelift.
Not facelift. I'm just angle of the mouth. You want a left. That part you can do with the Botox part.
Okay.
Or certain patient who have got platysmal band in the early age, you can decrease that part.
Okay.
Okay. These are just a cosmetic part of the Botox.
Okay.
But Botox works in other non-cosmetic areas also for us.
Okay.
Like patient who have got sweaty skin, sweaty axilla, hyperhidrosis is there. So these areas they work very good. Okay. It decreases secretions, so certain patients which come to us, they have got lot of sweating in the hand, they cannot shake hand, they cannot even write it.
Yes.
So these are the right patient to start with Botox.
Okay.
Definitely you can drastically see the changes.
Okay.
This is a non-cosmetic part of it. Then come to the filler.
Yes.
In fillers as the name says, it's to fill. Okay, we are adding something there. We are not taking out, we are adding. Okay, the compound nowadays most widely used worldwide is hyaluronic acid. Okay, it's very, very safe. There are other compounds also which we are using in a filler. There are certain hydroxyapatites are there. Okay, these are the fillers that we can use. Okay, there are certain semi-permanent filler. But most common worldwide safest filler comes is basically hyaluronic acid. That's the safest filler. There are a lot of companies which are marketing, and there are different types of there depending on the area which we want to inject, and we do that part. That's so simple. Just this area. What it does now? What does filler work? Like suppose we start with simple thing. Most common procedure for filler is the lip augmentation. They want lip to be slightly lip enlarged, slightly more defined. That's the easy part to do. You can get it done. Okay. And certain patient who have got under eye hollowness in the initial part, in the initial young around 35-40, then you can do the filler part to decrease that part. As you age, of course, limitations are there, quantity are there, then you can do that, but you can fill that part. Now other areas which we can do the filler is certain patient they wanted the chin to be augmented.
Yes.
Okay, they want more prominent chin. There are certain areas they want the cheek to be more augmented, more fuller. Certain area they want the angle of the mandible, they want to be more fuller. So these areas you can use fillers.
So it is correct to say that fillers are used for more of the we can say augmentation process of the.
Of course, it is to fill the cavities or to augment the things.
Okay. So we have seen because celebrities do a lot of plastic and cosmetic surgeries, so people are aware of that. We have seen surgeries होते हैं and people are swollen. उन्होंने botox कराया, face swollen लगता है. So these things people have to go for it. Is it like painful process और ये swelling वगैरह ये काफ़ी लंबे टाइम तक रहती है? Like कब आज अगर किसी इंसान ने botox या filler कराया, so or after what interval of time he will be able to be socially acceptable? मतलब वो जा सकता है बाहर.
These are basically these all Botox and filler. They are basically marketed as lunchtime procedure. That means you come during lunchtime, you get the procedure done, you go back to work. Its downtime has to be minimal. Suppose if you're doing a Botox, we are just putting needles there, very very fine needles. We are just injecting it, and normally nothing happens with that. The result of Botox they start coming after 3 days of time, and full result come in 1 week of time. So it's a latent period is there. But of course the problem that what can happen when doing injection, any injection in the body if you're doing, chances of bruising is there. You cannot avoid. Okay, we see the veins, we try to move away from them, but abnormal veins are always there. So sometimes you get pierce them and you get a bruising there. That patient has to accept, and we always tell the patient that bruising can occur. However hard we try not to give it to you, but sometimes it can occur. Okay. So bruising is the only thing that can occur, nothing else. Okay, if it occurs, okay, it heals. It takes like times to get okay. It takes around 7 to 10 days of time to get okay. Bruising gets okay. And if you're doing a filler, of course, anything foreign body, if you're injecting in the body, they felt certain tissue reaction. In body react with tissue reaction in the form of a swelling. Okay, these hyaluronic acid are very inert, so it doesn't cause much of the swelling until you do over injection or use a wrong product. With good company product, reputed company, FDA approved drugs, you're using the fillers, doesn't cause too much problem. Now a lot of fillers are coming from every other place which we don't know. So accreditation is important. Accreditation is very important, and the doctors who is doing also is very important.
The hands of surgeon. So medical tourism is increasing lot in India, and ऐसा बोलते हैं like if we see cricket की बात करें तो Indian batsmen are the best. Likewise अभी India में भी हो रहा है, surgeons of Indian are best. So what do you think, अगर you are working since a long period of time, so So in your clinical experience, what do you see in cosmetic surgery where the most of the cases come for you?
If you're talking of medical tourism, once we started our practice around 23 years back, there were a lot of patients who were coming from the European side, from the American side to India.
Yes.
Because we were cheaply available.
Yes.
Definite answer is that.
Yes.
We were, of course, as a skill part, we were definitely at par with them, but we are cheap compared to US.
Cost effective.
Cost effective, okay. Initial part they were coming to India. In the mid part, because certain other countries we started working in lower cost and close to their country, like if you talk of Turkey, the Europe part, the Europe people are going to Turkey most of the time because it's very close to them. You can go by car and you reach Turkey, okay, and the cost they are also doing very cheap way. Of course they are skilled also, but they are doing also very cost effective way. So initial part we had a bet ki the people were coming less to us in between. Now again the skill part has improved tremendously in India, and we are reaching all the places, and the communication and transport has improved with all the flights and everything. So India again is becoming a center for all the cosmetic procedures, and it's increasing tremendously here. We are getting patients from USA, Australia, Europe, and to South Africa. Everywhere we are getting patients here now.
Okay. One more question, sir. Like, do these surgeries, जो cosmetic plastic surgeries होती है, they make face little expressionless ऐसा है? Like we see couple of people, वो कुछ नाम नहीं ले सकते celebrities का, but after the surgeries their face become little expressionless, या कह सकते हैं कि थोड़े prototype type लगते हैं. जो करा रहे हैं cosmetic surgeries, उनके face थोड़े similar लगने लगते हैं.
It's not like that. Plastic surgery means we are enhancing the beauty. We are not changing your character of the face, or we are not changing your facial all the features. We're just enhancing it. Okay. There's a thing I tell you, from where you have got it done and what your desirement is. There are certain things your desire. Okay. In plastic surgery, in cosmetic surgery part, we are just working on the patient desire. And we discuss with the patient what you desire and how much it is possible by the surgery, how much is it possible by non-surgical treatment. These two things come in together, but your desire matters more. Okay, as a surgeon or as a physician, our job is to tell you just one thing, that this is safe for you, this is not safe for you. We guide in such a way that the procedure that you go through is absolutely safe, and the result is achieve what you desire. Okay, but if your desire once ki nahi, I want to achieve like this, that a certain patient will get certain desire which we don't expect. They do my face like this, do my eyebrows in a different pattern. So if you go in that desire, and of course certain surgeons do agree, okay, and they do that part, and then you see the result of that.
Okay, so it's very important which hands you are in. Okay. Coming to hair, sir, you do a lot of hair treatments. So cancer patients हो गए या baldness हो गया, alopecia हो गया. So I want to understand what is the difference between hair transplant and hair regrowth process. Basically,
hair transplant is we are sharing your hairs. Means it's basically a word known as hair restoration rather than a transplant. It's a basically auto transplant. We are taking from one part of the body and putting into the other part. We are not taking from other body. It's not an allo, it's an auto. Means we are taking from your back side most of the time, on the occipital area, or from the beard, all the body, and we are putting them in the head. Okay, it's a hair restoration. We are sharing your hairs, we are not adding anywhere. Okay, in hair regrowth, if you're talking about, hair regrowth is basically a non-surgical procedures. With medication we try to decrease the rate of fall, and there are certain drugs now have come which will improve. There are certain treatments like GFC, PRP, exosomes you can combine together to decrease the rate of fall and certain improvement in number of hairs. That's you.
Okay. So why men में एक certain area होता है there only baldness happen? Like why it is like that?
It's a very simple thing. It's a medical clear-cut answer is there. Like there is an enzyme.
Okay.
5-alpha reductase type 2, which is present in the roots of the hair. Okay. That enzyme is present mostly in the area which you have marked, in the frontal, temporal area, in the vertex area. These are the area which is mainly present. In the back area, in certain patients, it is always also there. But most of the patient, they have present in these areas. These enzymes, they convert the testosterone to a DST.
Okay.
That DST causes dormant phase of the hair, so hair start falling. Okay. If the patient has got these enzymes in the back area, so you must have seen certain patients who have got baldness in a lot of other areas also.
Okay, correct. Sir, बात करें कोरिया की. Korea is, I think, cosmetic surgery में I think number 1 पे है where they do this cosmetic surgeries more. So their glassy skin and all, that is because of that, or that is because of genetics?
It's basically 90% genetics.
90% genetics. Okay. That's a good news. Okay. So thank you, sir. We have really learnt a lot about plastic surgery topic. It's a vast topic. In one podcast, definitely it's very difficult. At last, I would want you to tell our viewers कि अगर उनको किस स्टेज पे ऐसा आप बोलेंगे कि हाँ, अगर आपको ये चीज़ डेफिनेटली बोटॉक्स कराना है या फिलर्स कराना है, इस सर्टेन एज में आपको आके कराना चाहिए, या आपको कभी कुछ ऐसा लग रहा है तब आप आइए और प्लास्टिक सर्जरी के पाथ पे स्टार्ट कीजिए कुछ अपना प्रोडक्ट. एनीथिंग यू वांट टू टेल अबाउट दिस थिंग?
The thing is, at what age, if you ask me about the cosmetic procedure, it's very difficult answer. Okay, it's a very difficult answer to point out that you people go in this 25 years age or 35 years age. It's basically when you feel your skin is dull. Okay, when you feel they have got slightly wrinkles are there in the forehead, other areas, you can always consult your specialist. Okay, he or she will guide you properly. In which age you have to. There are certain treatment like known as preventive Botox. Okay, and which we do the Botox in the areas to prevent the wrinkling. Okay, so that one part of the treatment is there. We are not treating the wrinkles, we are preventing it from forming it. Okay, so that, and there's a specific age, nothing specific age on that.
It's not age specific.
Age is not specific. It depends on the age when you start seeing the wrinkles. It can happen 35, it can happen 40, it can happen 45. Okay.
It's not age specific?
It's not age specific. Now if you come at age 20 and start doing the Botox, then it's difficult to tell you that you are not the right candidate for the Botox right now.
Understood. Okay, sir. Thank you, sir, for giving your time, and hope we'll meet again in future.
Sure.
Thank you, sir.
Thank you, Dr. Shweta.